As families gathered together this week for Thanksgiving, health officials are concerned about a triple-demic of respiratory illnesses, the flu, RSV, and COVID-19. Hospitals across the country are already bracing and facing a shortage of pediatric beds. And we traveled to Boston to find out why. For every patient discharged from the Pediatric ICU at Mass General for children, 3 more are waiting for that bed.
I've never seen in my 26 years the capacity issues. There's no PICU beds in the Northeast.
A surge of RSV cases has hospitals nationwide struggling to treat patients like 1-month-old Alma.
She went from, breastfeeding to being intubated in just one day, and I was so shocked. You're doing such a good job.
When she saw her baby gasping for air, Gabriella Bolting went to the local hospital. Alma was then transferred to Mass General.
It was certainly a concern whether or not we were going to be able to find a bed. My husband and I even started calling everyone we know who we could think of who had any affiliation with the hospitals.
Alma did get a bed, but had to wait more than 6 hours for it.
It's not hyperbole to call it a crisis.
Dr. Paul Bittinger oversees Mass General's emergency preparedness and says the hospital has been forced to move some children into the adult ICU.
The healthcare system has shown extraordinary flexibility in creating critical care spaces when they're needed.
36 states are seeing elevated levels of RSV cases compared to this time last year, and hospitals in 10 states are at or above 80% capacity. Many hospitals converted pediatric beds to adult beds during the pandemic, and some have not switched them back. Despite the challenges, Dr. Bittinger urges parents to bring their child in at the first sign of respiratory distress.
They should know that all of us in healthcare are doing everything we can so that when a child is sick, we can deliver the care immediately in a timely fashion, and we will find a hospital bed for that patient.
Agencies, including the American Academy of Pediatrics, are calling on President Biden to declare an emergency to help hospitals respond. And we've got an update for you on baby Alma. She's out of the ICU, doing well, and breathing on her own.